I'm Megan Walker, and welcome to Healthcare Online. Today, I'm joined by our very special guest, Carolyn Vills, who's the Director of Health Change Associates. Hi, Carolyn. How are you today?
I'm well, thanks, Megan.
That's good. Very excited to have you along here for a chat about your background and the work that you've been doing and the shift that you're making into more of a scalable, growth opportunity that you've picked up and that you're running with. So do you want to kick us off and tell us about who you help, who you serve, and the journey that you're on currently?
Yes, so basically, I have been in the training space for a number of years, but I'm also a frontline physiotherapist by trade. And basically, I help professionals and leaders trying to help their job to enable them to work smarter, not harder. And I do that by using a systematic training and implementation approach that really increases the uptake of advice. The ultimate aim is so that care consumers can go out and do what's needed and get better health outcomes, and the healthcare providers can get better job satisfaction because they're more confident to deal really with the complexities of working in healthcare.
Absolutely. And so this is a really fascinating area for our listeners are going to be leaning right into this. So we're talking about optimizing a consultation so that the patient or the client is, you fill in for me, is having more agency around their journey? Are they following instructions? Tell me, what's the aim of the overall big picture? What are we wanting to achieve here?
Yes, well, you've hit the nail on the head because it's actually what the service provider does to actually look at the way they're conducting that interaction to make it more likely that they can share information in a way that actually motivates people to actually go and follow their advice. So we have developed a really robust clinical practice methodology called health change methodology. And what that is a practical set of tools that more clearly defines for workers what they need to do to personalize the interaction so they connect with people quickly and can do everything within their power to influence and make it more likely that people do follow their advice without basically kind of assessing them and telling them what to do without providing the help. So basically, it's health change methodology is a practical improvement system that embeds person-centered care. And I know that there's a lot of
No,
jargon there.
that's all good. We're following you with bated breath. And so, what are some of give us the top three mistakes that you commonly see people making before they start working with you that might lead them to realize, well, hang on, I might need it. I know my stuff clinically, but maybe I need a little bit of help in the delivery. So, what are some of those common mistakes that you come across that give you a royal eye twitch?
So the common mistake is that the way we've been trained tends to mean that our process is that we do a really detailed assessment, mainly so that we can then give those recommendations and jump straight to, in our mind, helping the client to actually do what's needed to improve their health. But the major mistake of doing that is that sometimes clinicians miss the fact that the client's actually not keen on that information, or the clinician may end up talking about or assessing in areas that the client has no intention of training, which of changing. And so that means that they kind of don't get on the same tram at the same time. And this is the challenge for health professionals, that they, in order to respond to those more subtle cues, and professionals are good at picking up the cues, but often the way our professional development courses have been um, created, it doesn't help them to quickly be able to respond and do it in the moment with the person in front of them. So that's really the common challenge that most professionals struggle with, as well as the challenge of we're always trying to do too much in too little time.
Absolutely. So it's really a reframe, isn't it? I could imagine a lot of clinicians, therapists, and practitioners are thinking the measure of success of that consultation will be to share as much information as humanly possible in the shortest period of time, and that must be a good thing because there I've shared all of that wisdom.
Absolutely. And it's really just highlights that health professionals, while our knowledge is often absolutely critical to influencing what people do,
Mm.
a lot of the time there's a large percentage of patients out there that actually know what to do. But the trouble is they're not doing it either because they're not motivated or they haven't got a really strong internal driver, or they may have a lot of really serious challenges that stop them doing what we might consider is quite a simple task. And so clinicians actually need to be experts in influencing behavior,
Yeah.
and that's not really necessarily always been the focus of their education.
Wow. And so does that involve in when we're shifting our mindset from, okay, I'm going to go bulk overwhelm to now I'm taking you on more of a journey of results or outcomes? Does that involve coaching skills or what are some of the tools that someone would need to make that mindset shift? I know we don't have time to cover the how, but how do you switch from, hang on, I've got to give you absolutely everything I know, that's not working, what happens up here to shift gears and what do they have to become more of?
Yes, well, ironically, Health Change Associates started as Health Coaching Australia. So we started in the coaching space, teaching
Yes.
the coaching skills.
Mm.
Very probably as a similar to kind of a university course, we went back to the literature, the psychology and behavior change literature, and that's where we started. And we quickly realized that the feedback we got from health professionals was, don't tell me about the concepts and theories, just help me with what to do when I detect something with the person in front of me. Because, of course, this is an immensely complex skill. And if it was so simple, we'd all be doing it.
Yes,
So
absolutely.
it is the coaching skill set. And so
Mm.
everybody sort of often knows that they should be listening, that they should be checking in. But where health change methodology helps them is that we just give a set of these practical tools that cuts all the jargon out and enables them to manage the complexities with a little bit more structure and um, guidance as to what the strategies the professional should be focusing on.
Oh, that's so good. So you're actually going to get a client-centered result. You're shifting the focus, aren't you, from the clinician delivery to client journey? Is that fair to say?
Yeah, absolutely. But at the same time, there's for some health professionals, they get very nervous about. There's a lot of misperceptions about what client, patient, person-centered practice is, and that's fundamentally what our training does. It helps you really actually get a much clearer view of, it's a lot more than I thought it was. And so we clearly define that. We talk a lot about that. And but what we also clearly say is that a health professional's role is to tread that line between balancing your duty of care with the client's right to choose what they
Choice.
will and won't do, which is, though, that fundamental concept of person centered care. Yes, it is all about the person. However, for a health professional, they sometimes get nervous and but say, but they have to do this for their health or they're going to die. And while, yes, that may be true, it's the way you frame that to the client that avoids that dreadful thing of I'm telling you what to do. Because we know that if we do that, there's a 2 year old in all of us that'll come out and say, just because you told me that and the way that got me offside, I'm not going to do it.
It's like, go ahead, rebel.
Yes, yes.
I love it. I didn't realize until only recently that some negative behaviors are actually, oh, well, I hadn't thought of it in this way till it was pointed out in a coaching program that some negative behaviors are actually serving people. They
Mm.
gave the weight loss example of, well, if I stay on the couch, I'm warm, I don't have to move, I don't have to buy exercise, joggers or shoes or leave the house. And so, whilst my negative behaviors are not serving me, sometimes they also are. Now that's getting into a really deep iceberg, but this is so multi-layered what you're teaching, isn't it? It's not just structuring a
Yes.
consult, it's what do you do with the person who I'm not interested in what the clinician's
Mm.
got to say because my current behaviors are actually serving me. So what
Yeah.
am I asking you? It's a huge picture, isn't it, of change and how do we approach that change? And tell me what thoughts you've got around that.
Yeah, well, you absolutely correct, which is why on the great thing I think about the methodology is that any health professional can do it at any level of their career and they'll get something from it. Because really experienced clinicians have already kind of learnt all this stuff on the job. And our point is, hey, let's not wait for everybody just to learn it after 20 years of practice. This is a skill set that you can teach. And that's what we've done is we've really cut through the complexity and labeled the 6 or 7 skills. But what you've highlighted is each of those 6 and 7 skills has other depths of layers in their application, and you won't necessarily need all the tools all the time. It's not a a compliance program, but it just bridges that gap to help professionals apply the concepts that they're trying to achieve, because professionals know the concepts, but it's giving them a little bit more of the how. But there is definitely lots of layers.
Oh, so love it. Okay, beautiful. All right. So in your own career journey, I'll get you off the hot seat. Miss Gurley, that was really interesting. I was like, oh, tell me more. So you were a physio, and then how did all of this come about and why education? Like, you could still be on the job, you could still be hands-on. Tell me what was the maybe the trigger point for you changing the way you work, and
Mm.
tell us more about your why.
Well, ironically, it was one of those sliding door moments that colleague of mine, I was catching up. He had just shifted roles, and I said, "What are you doing?" And he said, "Oh, I'm involved in rolling out these courses called health coaching at the time. Oh, you'd love it." And I went, "Oh, really? What's that?" So this is a long time ago, over nearly 2 decades ago. Um, and I just happened to go to the course. Now, I had already done my undergraduate, a postgraduate, a master's by research, and countless thousands of professional development courses and conferences. And I went to the 2 day training and my jaw hit the ground because it just totally clarified the missing piece of the puzzle for my practice. I was working in the area of chronic pain, and I still am working clinically, and it just helped me immediately see, for me, as I listened to the concepts, I went, oh, yes, I do that one, I do that. I went, oh, I don't do that one. Oh, that's an easier way. And more importantly, it highlighted and taught me conversational shared decision making skills and ways to share information that are more effective. And as we've highlighted, that I just went, oh, now I get what I can do differently. And I've been through that practice change journey myself. And at times it's a little confronting. But once you just get over yourself and you lean into, hey, nobody's ever an expert at this, dealing with people is the hardest thing we ever do, um, it becomes a fascinating and really rewarding process. And so then I jumped on board and became a facilitator, and have then worked with the company in all sorts of different roles. And now I'm the director of the company myself.
Fantastic. I love the key words that you said, lean in. I think sometimes in our careers we're faced with a juncture of frustration. And it's like, well, is that what do I do in response to that? And one of the actions is always lean in, do it, find a way to do it better. I could see that really lit you up. And so now that you're right on this journey, tell us about your vision for how you work, and is this, having a program as opposed to selling time in your clinic? What does that look like for you in the future?
Well, the training elements of health change methodology have been consistent for a while, and I transferred during COVID. It used to be all face to face, and I transferred during COVID the course to a blended online platform. And really, I think what your program has helped me do is find, in some ways, a better, more responsive platform that really can give professionals that flexibility. We know that it's really hard for organisations to release staff for, full day or 2 day workshops, even half day workshops these days. So the more we can chunk it down and deliver it in flexible bite-sized pieces, the better. And what I've been able to do is really develop not only the content delivery elements, but the reflective practice and the practical application and implementation elements by using, I think, a better, more responsive learning platform. So that's been really, I think, productive. And I think this platform has also helped me to stay in touch and keep connected with the people that have done the course. Because in the past, we certainly know that doing the course is the first step of the journey. Then you're left with changing your practice. And the good news is that we know the feedback we get from professionals is that many of them find that this is a course they can immediately go out and apply and get quite immediate quick wins on the board by just doing small tweaks to what they were already doing. But what we know is the biggest challenge is keeping that momentum going. And we know that for time poor clinicians to do that, the best way is to have the implementation support embedded into their workplace so that they're doing those conversations with their colleagues in the corridor, or having their case discussions or their times when they meet together, that really reinforces the training that they've been to. And a lot of the comments that I get from professionals after doing the course is, I wish everybody in my team had done it, so that then we could all use the same language and understand the tools so that we can all walk this path together.
Yeah, well, how brilliant. Now you can say to them, and yes, you can. It's
Yes.
online. Step this
Well,
way.
yes, the challenge that is that if we could all just read a book and get the knowledge online, we'd do it. What is critical is the reflective practice,
Yes.
both personally and reflecting with your colleagues, and more importantly, the real, where the rubber hits the road for clinicians is, what do I say to Mr. or Mrs. X on Monday for this particular issue I've got for their personal circumstances? And you've got to come up with the phrasing of what's the exact question I need to ask it, and how can I ask it in a way that doesn't get them offside, doesn't make them uncomfortable? And that's really hard.
Yeah.
Nobody can come up with, oh yes, it's this question. you know so that's the element that we have to allow, that richness of sharing and that safe space, so that we can all help each other, because often other clinicians have come up with kind of good ways that they find work in a similar population that you can immediately steal. We're all in for stealing good strategies
Benchmarking.
that make this steal the gold and start and make it yourself. And so that's where I'm really excited to be creating the Health Change Community Hub, so that I can really help with that layered implementation over time.
So good. So good. Now, what I wanted to ask you, and before we give people where to go and find out more about you, is what would you say to other clinicians who are thinking of having either a hybrid model, or they want to build some kind of program or online course? And what would your advice be, or your insights be, that you'd like to share with those people who might have a traditional practice but are looking at doing, something more scalable?
So I think the absolute benefit of your services, I think, for health professionals And ironically, of course, these are the key points, that messages that you keep reinforcing are absolutely the key points that I reinforce in my training. And it just kind of really highlights how knowing it just isn't doing it for yourself.
Yes, I know. Yes, knowledge without doing. Yes.
Exactly. So I think the thing that is brilliant about the services you offer is that it really speaks, the health professional market, and can really, people can come to your services knowing that they're not trying to be the next, massive Instagram influencer necessarily, that they can create what they want to share their knowledge in a way that's practical, doable, but ethical,
Mm.
and really, still will align with their values of what they want to create, and either help them expand their products to better serve our consumers or the patients we help.
Yeah, wonderful. Tell us where we can find out more about you, Carolyn. It's so amazing. The work you do is transformational. Where can we go and check you out, follow you, and sign up for health change methodology?
Well, I mean, I'm still, my comms and tech side is still a work in
It's
progress.
coming.
Definitely is one of my weak spots. But anyway, start at www.healthchange.com, and perhaps follow the link to our short practical course, which is right up front. And that website will be changing shortly, but that's a work in progress.
You've done such a great job moving a big program in the offline face-to-face into getting it into the digital. It's not a quick job. So we applaud you and everything you're doing. And thank you so much for having this chat with me, Carolyn. Being part of our programs, it's just a joy to work with you and get your material out into more people's hands as well. So thank you so much.
Well, it's an absolute pleasure, and it's been so fabulous to have a supportive group that are all going through the same challenges, so that you can ask really dumb questions and really get great feedback on what you're doing. And that's really the gold that you provide. So thank you.
Oh, pleasure. Thanks, Carolyn.